My name is Paula Hagel. I'm the exercise physiologist here at Good Shepherd Cardiopulmonary Rehab. And today we're going to be talking about physical activity guidelines. We know that exercise is medicine, and even Plato knew that the lack of physical activity destroys the good condition of every human being while movement preserves it. So exercise is medicine. Our goals and objectives today are to first recognize the health benefits of regular physical activity, review the updated physical activity guidelines, identify components of a complete exercise program, and understand how to safely exercise at home. The benefits of exercise. So why should I be active? Benefits include the following. Being physically active helps to reduce the risk of heart disease and stroke, helps control blood pressure, improve cholesterol levels, and even helps with weight management. Being physically active also helps prevent or control your type 2 diabetes. It increases energy, strength, and endurance. Being active increases or helps to maintain bone density. And exercising and being physically active helps maintain independence and can actually improve sleep as well. More benefits of being active. So being physically active helps your immune system. It can help reduce anxiety, boost your mood, help with relaxation, manage stress, and even fight depression. And being physically active helps self-confidence, improve quality of life, and can help you have less pain and help your mind sharpen focus. There's a lot of research going on with memory and dementia and activity, so stay tuned for more results on that. Okay, next in our objectives is to give you an overview of the updated physical activity guidelines. So every 5 years or so, the government puts out suggestions for Americans on what you should be doing for physical activity. And the updated guidelines highlight most Americans or most adults need 150 minutes a week of moderate intensity aerobic activity. So that includes anything that gets your heart beating faster. That could be biking, walking, swimming, hiking, gardening, chasing grandchildren, around the yard, just, engaging in any kind of activity that gets your heart beating faster. So every minute counts towards that 150 minutes. And then the second part of the updated guidelines is to do activities that make your muscles work harder, like strengthening exercise at least 2 days a week. And that can be, weightlifting or, doing push-ups with your own body weight, but at least those two things. Okay. And the new mantra is move more, sit less. Okay, so you can feel the benefits of physical activity, less stress, better mood, better sleep. Okay, so what does a complete exercise program look like? There are 4 components. You've got aerobic exercise, we just talked about, walking, biking, swimming, hiking, strength training, balance training, and flexibility. So those 4 components make up a complete program. And in cardiopulmonary rehab, we include all of those things in your normal exercise prescription. And when you graduate our program, we really encourage you to maintain that same program at home. And if you're wondering, how hard should I be working? Well, in our gym here at Cardiac Rehab, we have this scale. It's a rating of perceived exertion or how hard the activity feels to you, where 6 would be rest and 20 is a maximal effort. And the goal is to work between a light and somewhat harder, light to moderate effort. So we ask you while you're exercising in our gym, how hard does it feel to you? You know, is it a 13? Is it a 14? Is it a 15? If it's a 14 or 15, we want you to slow down. And we want you to think about that when you're doing activities at home. So if you're gardening and you're shoveling and you feel like, gosh, this is a very hard activity for me, I need to take a break, go inside, get out of the heat, have some water. So this is important to use in the gym, but also for your everyday activities if you need to. It's a good skill. And let's talk about what a safe exercise routine entails. Okay, so we've got 3 phases. We've got a warm-up, we've got the meat of the program, the aerobic phase, resistance training, balance, and then a cool down and stretch. And we're going to divide these up and go through each of them individually to give you a good understanding of what a safe and effective exercise routine sounds like. Okay, so with the warm-up, it's about 5 minutes of low-level activity. So that could be range of motion, gentle movements. It could be if you're going to go for a walk, that first 3 to 5 minutes is just a slow-paced walk, and then you would pick it up to your moderate pace. And that warm-up allows muscles and joints to get ready for more moderate activity, and it can help prevent soreness and injury. Okay. Now, the meat of the program can be aerobic exercise, strength training, a little balance training included too, you know, after. But we're looking at, you know, 150 minutes per week as a goal, okay? And that can be divided into, you know, 30 minutes most days, or, and one thing to remember is all activity counts. So, you know, the less you're sitting and moving, the better. And if you're not quite ready to take a 30-minute walk or, you know, bike for an hour or something like that, that's okay. Just start with a little bit of what you can do, even if it's just a few minutes, and then gradually increase it from there. And that aerobic exercise or aerobic activity, you do want to think about the exertion. So a light to moderate effort, target heart rate. If you're using a perceived exertion, you know, you can also check your heart rate. And there's a lot of monitors out there that you can, you know, an Apple Watch would be an example. There's a lot of different brands and, you know, out there that can monitor your heart rate, your caloric expenditure, all of that. But just as a rule of thumb, a good target heart rate for exercise would be what your resting heart rate is plus 30 to 40 beats for exercise. And METs, we're going to talk about METs in a slide or two. So remember that all activity counts. Okay, so start with a little bit and increase to at least 150 minutes a week of aerobic exercise. We also want to make sure that we're including strength training or resistance training in our weekly exercise, 2 to 3 days a week. Make sure that you're warming up and cooling down around that strength training activity as well. Okay, so what is a MET? And so a MET stands for a metabolic equivalent. It's how much oxygen your muscles are using to burn fuel to perform activities. And METs can be used to estimate the energy expenditure for many common activities. So 1 MET would be equivalent to the amount of oxygen your body uses at rest. Walking leisurely would be 2 to 3 METs. Moderate exercise would be 4 to 5.9 METs, and vigorous would be 6 METs or more. So examples of everyday activities that would be included in the light would be less than 3 METs would be, you know, cooking, food prep, walking less than 2 miles per hour, or light cleaning. Moderate 3 to 5.9 METs, walking the dog, fishing, golf using the cart, or gardening. Vigorous activities could be like chopping wood, moving furniture, or jogging about 5 miles an hour. And you can see the different MET levels there. What's important to understand is if you come to cardiac rehab and you know you're struggling at 4 METs in the gym, you know, you may want to hold off on, of course, the vigorous activities. So it just gives you a kind of an idea of what normal activities of daily living or that you could get involved with and be able to handle. Okay, so let's talk about METs and your risk. So if you were to have a stress test where the physician is able to get the peak functional capacity, if your peak MET is less than 5, your mortality or risk of death is highest. A moderate risk would be 5 to 7 METs at a maximal effort, and low risk for women would be greater than or equal to 7 METs, for men greater than or equal to 10 METs. And why we find this important is that your functional capacity or your fitness level, if you will, is directly related to your risk, your mortality risk. So if we can get you your functional capacity to be increased, then your risk will be lower. And for each MET improvement in your fitness level, your chances of dying from a heart attack decrease by about 10 to 15%. Okay, so these are just some examples of home exercise goals. Again, 150 minutes a week, but remember to start with a little and gradually increase duration. Every little bit helps, and even starting with parking a little further away, taking stairs, playing with the grandchildren, all of that contributes towards your 150 minutes a week. And remember, when you are doing your strength training, if you're doing just 2 to 3 days a week, you want to include 8 to 10 exercises for major muscle groups, and 2 to 3 days a week, non-consecutive days. And your resistance can be hand weights, bands, weight machines, pulleys, your own body weight would all work. Okay, so we've talked about the warm-up, the aerobic exercise resistance training portion. Now we're going to talk about the importance of balance training. And balance training improves walking speed, walking distance, and stride length, and these are all factors associated with reduced risk of falling. And balance exercises are encouraged 2 to 3 days a week, and working on your own body posture at all times. And we do have handouts in Chapter 7 in the cardiac notebook and Chapter 5 in the pulmonary binder. So we do have handouts for all of our different exercises that we do in class for you for home exercise. And finally, the cool down and stretch. The cool down's purpose is really to gradually decrease level of exercise over at least 5 minutes. So we want that last 5 minutes of activity to really bring down the blood pressure, bring down the heart rate, and really just bring your body back down to a resting level. And always, always, always listen to your body. Stop exercise if you have any of the following symptoms: chest pain, pain in the neck, jaw, teeth or arms, severe shortness of breath, lightheadedness or dizziness, nausea or vomiting, unusual joint or muscle pain. Pretty much if it's from your waist up front or in the back, if you have unusual pain or symptoms, you want to stop what you're doing. You don't want to push through symptoms. You want to stop and evaluate. And always notify staff. Of course, if you're out exercising, if you're at the park and you're walking and you start to have symptoms, stop activity. Make sure that, that you go with someone, that you have a cell phone. So if you get into having an issue, that you can contact. And just a few things to consider. You want to wait a couple hours after eating before exercising. It's okay to have a light snack and then go exercise, but you don't want to have a heavy meal and then be able to exercise after. Always wear comfortable, loose-fitting clothing. Make sure that you have good supportive shoes, that don't give you blisters. Avoid exercising in extreme weather temperatures, whether that's hot or cold. Always drink plenty of fluids before, during, and after exercise. And a few more considerations, especially if you've had open heart surgery, you want to ask your doctor's approval before you engage in any kind of strenuous activity. generally physicians will release you after 6 weeks, but if it's prior to that, you do want to contact your doctor's office before you engage in any kind of strenuous activity. And then smoking before or during exercise is dangerous, and it increases the work on the heart. For help in quitting, you can contact staff. We do have a tobacco cessation specialist on campus, so we can get you referred and connected with that as needed. And just a few things with sticking with it. Sometimes a pedometer can help, and even an old-fashioned pedometer that you put, that's real inexpensive. You just clip on your belt, and it will log your steps, minutes, and mileage. Fitbit or Apple Watch or Garmin, any of those, you see the photo there, just some examples of fitness trackers. Nordic poles or like ski poles as you're walking. It helps with balance. It helps engage your core. It can be a little bit, it can be fun to use those. And exercise or being physically active just kind of becomes a part of your lifestyle, a part of your routine. And if you choose activities that you enjoy, that helps even more. Getting variety is key. Trying a new exercise class, or take a yoga class or a Tai Chi class, or just something new and different you've never tried before. Try a new area to walk. We have a few great areas in Hermiston and surrounding areas that just are really safe places to walk. And hit high intensity interval training. Interval training, it doesn't have to be a high intensity, but for our purposes, it could be something as simple as just increasing your walking speed, until you're maybe a 13 effort on the perceived exertion scale, or a 14, just for 30 seconds to a minute, and then bring it back down to a light to moderate, and just increase the intensity a little bit and come down every minute, or anywhere up to walk faster for a minute, walk slower for 3 to 4 minutes, and then increase speed for a minute. You can do intervals like that with any activity, and you do want to do interval training maybe just a couple of times a week, but it can really make a difference in the amount of work that you're able to do. Scheduling your exercise is important. Getting into groups, it just helps you. It helps keep you to stick with it. Rewarding yourself, and of course thinking positively that you can and will do this. And this is one of my favorite quotes: "The journey of 1,000 miles must begin with a single step." So if you have questions, you can contact Cardiopulmonary Rehab with any questions or concerns. Our phone number is 541-667-3687. You can email me as well, and you can see that on your screen. So thank you for your time.